Good morning, ladies and gentlemen. Thanks for making the time to attend this Thursday presentation of the Overberg Geoscientists group. But I think most of you will be aware that in May 2018, there was a 5 billion rand settlement in a class action suit involving mine workers who had contracted tuberculosis, TB, and silicosis at work. Today, Claire Gavine has very kindly offered her services to present to us and talk about the background to this case and what it means financially. Claire completed her high schooling at Wickham Collegiate in Pietermaritzburg, which I have an affinity with, and then a Bachelor of Business and Actuarial Science from the University of Cape Town in 1989, and is a Fellow of the Actuarial Society of South Africa. From November 2009 to May 2015 as an associate with Charles Watson in Johannesburg, and has been senior manager at Deloitte in Johannesburg since June 2016. She is an actuary with demonstrated experience in the social security, retirement and health industry, with a strong focus on taking the actuarial skill set into the wider social development field. She's also worked with the Mine Workers Compensation Fund, which provides compensation to mine workers and ex-mine workers who have contracted occupational diseases specific to the mining industry, such as silicosis and asbestosis. Thanks, Claire. We look forward to hearing your presentation today and discussing it at the end.
All right, thanks, everyone. So as I promised John, I was going to discuss my experiences through, I suppose, the work I do. I am doing this sort of discussion in a private capacity, so it's not through Deloitte, just to note that. There were too many hurdles there to, I think, jump over, just bearing that in mind. So I really have limited discussion, and then obviously to everything that's publicly available, but I'm happy to share sort of all the documents, such as annual reports on the compensation fund, etc., and other sort of research I've sort of gained, I've read along the way regarding silicosis. So yes, quite ironically, a geologist's daughter ends up working as being one of the actuaries, Mine and Works Compensation Fund. So I actually started that work when I joined Deloitte. So I've been working with them for 6 years. So obviously I've learned a lot about occupational diseases in the mining industry. And yeah, our focus is really on valuations, disease modeling, but we obviously get drawn into quite a bit of other work. I've also had some experience with the estimations behind the class action settlements, having to review them. So that was also very interesting. And I've sort of done various other projects within the mining industry within Southern Africa, particularly relating to modeling HIV, etc. So as you obviously all know, my dad's a geologist for my sins, but I actually also come from a mining sort of family on my mom's side. My great-grandfather came over from Cornwall, I think the early 1900s, just after, I think, the First World War. He was working in the tin mines there, and he followed his calling, said to come and join the mining boom in South Africa. His son, my grandfather, was then also in the mining industry. I think the last mine he worked on was the tin mine at Overberg before retiring. Yeah, so he worked engineering and up to mine manager, so it seems to be in my blood. All right, so this is really what I'm going to discuss. So it's quite a high-level discussion, but I wanted to sort of put sort of the focus at a high level of, obviously we'll discuss silicosis a bit, but I'm sure you're all very aware of what I'm going to speak about that, having obviously worked in the mining industry, geologists, etc. We'll discuss the Mine and Works Compensation Fund, just some interesting facts about value and liabilities, looking at its future. Then we'll also look at the Share Trust. I don't know if I pronounced it right, but that's how I pronounce it, which was obviously established after the agreement reached in early 2018, being the first class action settlement in South Africa. And then just some problems with providing compensation in Southern Africa, because as you all know, our labor for the mining industry was obviously drawn not only from South Africa, but throughout Southern Africa. And then just some brief talks on eliminating silicosis, etc. So, I mean, as you're aware, so we'll just to define silicosis, we all know it's a form of occupational lung disease. So it's specifically a type of pulmonary fibrosis and is caused by the inhalation of crystalline silica dust. So your lungs are then marked by inflammation and scarring in the form of nodular lesions in the upper lobes of the lungs. So I found that picture, I thought it was quite interesting. I think I had seen it in another presentation. I think it's from the Basque Museum, one of the Basque Museum in Spain. So that's obviously a miner's lung with silicosis and TB. So quite interesting. If you contract silicosis, you're obviously susceptible to contracting TB. So I think that's particularly relevant in South Africa, given the socioeconomic conditions of I think the majority of our labour, as well as then you throw in the AIDS and HIV pandemic as well, and the strong link there between TB and HIV. Yes, I mean, it's definitely been a burden in South Africa. So obviously you all know it's a permanent disease with no cure. So treatment options are obviously focused at alleviating symptoms and stopping the progression of the disease, because it is characterized by radiological progression. So we'll talk about lung function a bit later, but obviously, you know, if you monitor the progression over time, this will be sort of characterized by a reduced lung function over time. So the geologists, you obviously all know, it's a widely occurring mineral, but it's occurs naturally in quartz. There were a couple of others, but I focused on quartz because obviously that's relevant to gold mining in this country. Interesting, if you look at all the research, as you may well know, but there are some, I think, some South African papers. Also, there's a Chinese and Canadian paper where they've actually modeled the risk of developing silicosis and correlated, you know, modeled it relative to your cumulative respirable quartz. And that is in milligrams per cubic meter over year, measured over cumulatively over years. So you can correct me if I'm wrong, if I got that wrong, but yeah, some very interesting papers out there. But obviously, I mean, that is silicosis and why it's become such a problem in South Africa. So interesting enough, and this particularly makes it difficult, I think, in terms of compensation in this country, is it's silicosis, along with, you know, your asbestosis related diseases, are all characterized by long latency periods. So this is the time from when that passes from when you're exposed to respirable quartz to when your symptoms actually develop. So academic studies suggest up to 40 years for silicosis. That's much longer with asbestosis related diseases, etc. So if we look at silicosis, then given there is no cure and specific treatment, the only way to protect workers' health is then obviously to control exposure to silica-containing dust. So then if we specifically look at silicosis in South Africa, so obviously mining has played a central role in the development of South Africa, its history and its economy. So, you know, our history has very much then been characterized with mining and the related silica exposure, silicosis, and then TB as well, tuberculosis. So gold miners have then obviously also borne the largest burden in relation to silicosis and TB because of the high silica content of gold-bearing ores. So some of the statistics were 9 to 39%, etc. But I'm sure you guys are quite aware of that. I think if you look at historically where we came from, our mining boom, where labor came from, historically, you know, and then just I think put into context our past, apartheid, etc. Obviously, historically, we have had inadequate dust control in South Africa, which has obviously then lent itself further to exacerbating, you know, our silicosis burden. So there is a interesting statistic that's quote. So there was a study done in the early 1990s, but only 8 out of 48 mines had estimated quartz concentration levels widely used, below the widely used reference level of 0.1 milligrams per cubic meter. So that is actually quite an interesting, I think, level, because we're going to discuss it a bit more. I have sort of referenced here then there is a very interesting paper. So then, as we discussed, the studies have then plotted the risk of silicosis compared to your cumulative dust exposure, etc. So, markedly, silicosis risk starts at about 3 milligrams per cubic meters over cumulative years, and it grows rapidly after 7 milligrams per cubic meter over cumulative years, etc. But they did conclude that even at exposure levels of less than 0.1 milligram per cubic meter, 19% of mine are still contracted silicosis. So we will touch on that a bit more in the talk later on. So, using a safety level of 0.1 milligram is really there's still quite a risk associated with that level, or that ideal level of dust exposure. So, I think the big question out there, and this was a bit difficult because I didn't want to quote too much, but there is stuff available, because while the compensation fund discloses its liabilities, it doesn't necessarily disclose our estimates of numbers, but there is a sort of a ballpark estimate with the Share Meso Trust. They're looking at potentially 40,000 claimants, and that's allowing for a less than 100% payment rate, which we'll discuss. But studies of X miners suggest obviously prevalent rates of silicosis from 26 to 36%, and there are various studies you can refer to there. I do then. Oh, sorry. This is a very bad graph. I was going to try and find a clearer one, but I do sort of like to touch on this. Is, obviously mining's contribution to economic production, as you know, it's far off its peak, which was sort of in its peak in 1980, with its employment peak, I think, in 1987. So that blue line there. So you're looking at size peak, it was employing just over 760,000 individuals. We know now it's hovering at probably less than 400. It's, I think, gone up to just over 400,000. I was looking at some updated statistics for TB in mines, and just looking at frequency and incident rate, and they have come down. But we also, I think, looking at employment, maybe just over 400,000. So correct me if I'm right. And what I want to really point out here is, you've got your peak there in 1987, and we're looking at 35-year period since its peak. But, it may be a long time, but put into context of your latency period, which can be around 40 years for silicosis. We are still dealing then very much with, silicosis coming to the fore in a particular X miners. And that, there's obviously a large burden out there. And then obviously, I think what's important to know with gold mining is, obviously, for a long time, it was the predominant mineral in South Africa. And given its high, silica content in quartz, obviously, and it made up for sort of above 90% of our output. It has been by far the main contributor to the silicosis burden in South Africa. So touching on that sort of that burden that we are now facing with the long latency period of silicosis, there is a large burden, and it's undetected, particularly in lung disease in my ex-miners now living in labor-sending areas in Southern Africa. So, obviously that's important. It's not just South Africa. Those, we drew a lot from Malawi, I think Mozambique, Zimbabwe, Zambia, etc. So there is now a large sort of undetected group. They may know that they have silicosis, but it does mean that there are problems in providing compensation where you don't know, these individuals exist in terms of numbers, you can quantify it, but where are they, etc., and how do you find them? So this touches on a very important point in terms of underreporting, and it's particularly relevant, as I said, to the effectiveness of compensation for the contraction of silicosis through not only the Mining Works Compensation Fund, but the Share Meso Trust. So to touch on some points there, why is it so undetected? Well, ex-workers do not know that they've contracted a compensable disease, or where to go for medical examinations, or even what the claim process involves. Unfortunately, that is the reality of our labor in Southern Africa. So the medical facilities are obviously not necessarily available to perform medical examinations or far away from ex-workers, which means they've often then got to pay for transport and then possibly then pay for the medical examination up front. So there are huge barriers to actually accessing this compensation. And also to know ex-workers do not necessarily have the necessary documentation, etc. And therefore find it difficult to submit the application. So this is, put into context, this leads to what we call a large there's a large burden out there, but the underreporting is quite rife in terms of where these individuals live throughout Southern Africa and how to track them down. So if we look at the Mine and Works Compensation Fund, it is obviously regulated under DEMWA, so the Occupational Disease and Mine Works Act. It not only covers silicosis, but it covers TB if it's cardiopulmonary TB, silicosis, coal workers and other pneumoconiosis, obstructive airways disease, a couple of smaller sort of diseases, and then obviously the other big one is asbestosis, pleural, interstitial or combination, and then the various sort of asbestosis cancers. So despite, I think, asbestosis mines, I think they closed early 2000s, 2004, we obviously, the fund is still seeing claims in respect of these asbestosis related diseases, etc. So it also covers joint conditions, and the scary thing is there are cases where individuals have silicosis as well as, say, obstructive airways disease, as well as asbestosis. It's pretty scary, but these cases do exist as per the data. And then it's also very important that the condition was contracted while performing risk work or past risk work. And this is subject to conditions of the disease. So they say you've got to obviously work a minimum of 200 risk shifts for these claims, which obviously makes verifying claims quite difficult. And it's got to be related to risk shifts conducted in a controlled South African mine, which is, in order for the mine to be controlled, there's certain register, it's got to be registered and pay levies to the compensation fund, etc. So obviously that also brings into the issue of uncontrolled mines, because they do exist within South Africa. So in order for them to qualify compensation, you will have your claim certified by the Medical Bureau for Occupational Diseases. So they obviously have medical specialists, etc. And then they will certify your claim. And really there are three different types of claim. So first degree looks at impairment of your lungs and it looks at about 10 to 40%. So the claim amount is currently up to just under 66,000. The second degree compensation looks at impairment greater than 40% and or multiple diseases. So for example, if you get TB and silicosis, you immediately certified as second degree, even if your lung impairment is less than 40%. So you can get a claim amount of up to 146, just under 147,000. So the rules vary as to compensation. For example, you won't get that full amount for second degree if you've already claimed for a first degree claim. TB then, there is TB first and second degree, but they also then reimburse for loss of earnings incurred for a maximum period of 6 months, and they only reimburse for 75% of the earnings payable. How is the fund funded? Well, they collect levies from controlled mines and works based on the number of risk shifts worked in the mine, multiplied by specific rate per commodity mine. So that makes it easier. And if you look at the rates gazetted, if you actually look at then the rate per commodity per risk shift, your highest will be gold. So these levies are gazetted, so you can find them. Given that gold is obviously by far the driving commodity in terms of silicosis, etc. I think next is platinum and then coal. So I can provide those lists, etc. But it does allow some leeway for obviously penalizing the commodities that cause, that are the cause of, drive your occupational diseases in the mining industry. So just to give you some background, I started working on the fund in 2006 when just after I joined Deloitte. We just won the three-year trial tender. We then won the second 3 years. So at that stage, we got to know the new compensation commissioner, Dr. Barry Kisnasamy. He was appointed back in 2012, and he really inherited a mess. There's quite a bit on this in, if you go to the Parliamentary Monitoring Group, they obviously have minutes to all their meetings, etc. And, I think he's made significant progress for a, let's say, public entity since his appointment. There were backlogs to annual financial statements, actual valuations, claims processing, etc. So he was very much supported by the Minerals Council South Africa, and they provided not just financial resources, but the secondment of personnel and technical support for the financial management and legal reforms since his appointment. And as far as I understand, they still are providing the support. There is an external private company that has been involved since I think we basically got involved with the fund, just helping with the smooth operation of this compensation fund. There's some statistics there. I wouldn't sort of worry, just to give you some feel of, they pay about 435 at the moment, payments per month, sitting at 141 million. So, on average, they pay on over $1 billion a year. But obviously the impact of COVID has, and we'll touch on this again with the Share Miso Trust, has obviously affected interventions with the provision of BMEs, your benefit medical examinations, which I'm sure most of you probably had to do at one point, and through their outreach activities. They're also working very closely with the Share Miso Trust, given that there's an overlap with eligible claimants in the class action settlement for silicosis and TB in the gold mining sector. I thought I'd just touch on some of the actual side of this. The methodology is actually disclosed in the annual financial statements, but it really comes back to how we estimate underreported claims, because one of the big sort of issues that when we came in as actuaries was we not only had to estimate sort of claims that come through on the normal course of events, but there are this large burden of undetected silicosis in sort of ex-mine workers, and it was key that we placed a number on that liability as well, because I think when the new commissioner came in, and obviously with the discussions, the class action settlement, there really was a focus on how do we redress the wrongs of the past, and it was then sort of identified that they really needed to estimate how many individuals out there, ex-miners. I'll use the word ex-miners because I think if you're a miner nowadays, I think if you detect for silicosis, you're very much kept within the system. So, it was really a sort of a focus on, let's estimate how many of these ex-miners out there in Southern Africa have silicosis, are still alive, etc. And then how do we find these individuals so that they can be actually appropriate and meaningful redress to these individuals, not only from the compensation fund, but given that the class action settlement, well, it hadn't been settled there, but it was an advanced stage of settlement. Actually, we call this, we've got to estimate incurred but not yet reported claims. So we look at, risk work right to the valuation date. We've then got to estimate how many individuals will still come forward in future when they've contracted, say, silicosis, etc. And that's obviously quite difficult when you think of the latency periods involved, sort of 40 years for silicosis as per academic research. We actually use a period of 45 years for silicosis based on the data. So in order to then calculate this incurred but IBNR provision, we look at run-off triangles to model development pattern or reporting delay over this 45 years and settlement pattern then, because it takes a while to settle some of these claims. So the most then important then part of this estimation is this allowance for underreporting. So as we've discussed, it exists when workers are eligible to claim from the fund but don't do so for various reasons. And it's obviously particularly relevant to your permanent diseases like silicosis and asbestosis, where there's a long latency period. So if you look at your estimation of your estimation based on claims experience, you're going to completely understate the number of full claims that are out there. So because that'll exclude the underreporting. I thought it was quite interesting to touch on this, but I mean, obviously underreporting, it may have sort of different names, but you know, you've probably seen a lot about unclaimed benefits in the retirement industry. That's a big issue in our country at the moment. 45 billion they estimate is sitting there that is due to beneficiaries that hasn't been paid out. So it's not just sort of unique to mine and works, but I think it's you know, the mining industry, but it is definitely exacerbated by the long latency periods of silicosis, etc. You know, so it is sort of an issue, a broader issue out there that we've got to address in South Africa. Sorry, let me just get that. All right, so how we actually do this, I'll quickly talk about it, is we actually separate the data by white miners and non-white miners. Because I think historically, I think white miners were, you know, I think, well, few and far between. Now, they were historically career miners, and, you know, given the education, etc., and definitely the divisions that were sold by apartheid, they were definitely, I think, aware of benefits, had access to medical facilities, etc. So we would expect then mine work white miners underreporting to be very minimal. And this is displayed in this graph here, that over the development period of 45 years, you look at seen a very gradual progression towards 100%. So if you look, this development period is based on your last risk shift or work. So it's very much when you left employment. So you would expect then, you know, underreporting when you've been active and just left employment to be sort of minimal, whether I think you black or white, non-white or white. So, you know, for the non-white then development pattern over there, you see, you know, obviously a high proportion get reported just after or just as they leave employment or exit risk work, and then it peters off, etc., to 100%. But most, you know, the highest proportion then is then reporting those first 2 years. So, you know, we take a step back, we look and we say, well, if there was no underreporting in non-white workers, their development pattern should actually follow very much the white miners' development pattern. And that's how we actually estimate underreported claims. We then extrapolate, etc., and apply a white miners' development pattern to estimate, you know, those payments that were eligible for compensation but never came forward. So what we say in there is we manipulate numbers so that we actually get the data in respect of non-white miners to reflect this development pattern here. So I must say, I think this I've covered already. So discussing the graph, but really I think underreporting is very much reflected through race. I think that is a product of our past. And hence we very much use the differences there to estimate the number of underreported claims for compensation from the compensation fund. If we just look at the future of the compensation fund, so this is also documented in the parliamentary monitoring groups. They are looking now at closing, well, not necessarily closing, but transferring future mine workers to the compensation for occupational injuries and diseases fund, so the COID fund, which sits under the Department of Labour. You know, I think now that they've almost sorted out the backlogs, it was never on the table until they sorted out the backlogs at the compensation fund. So then you would have sort of new mine workers going into that fund, and then running off current CCOD for ex mine workers at the cutoff point, and sort of running it off like a closed defined benefit fund over time until the last miner alive, etc., is paid. And what's interesting about this move is that the compensation fund itself, the Mine Works Compensation Fund, only provides monetary compensation. So it has been on the radar that, to introduce some sort of medical assistance for silicotics as well as other, diseases, etc. So the COID will then obviously provide that medical assistance in addition to financial support. All right, so then we look at the Shemisa Trust. So, it's a set one word, quite interesting to say, to make good, to correct, and obviously that's quite an important statement, given that it was a historic class action settlement, which was reached between mining companies and obviously the claimants. Attorneys, the most, I think, well-known one is Richard Spoor. He's, I think, now trying to lead the way with a similar class action within the coal industry, the coal mining industry. So obviously it involved a lot of your big gold mining companies or former gold mining companies, etc. So it didn't necessarily represent the full sort of all mining houses, etc., but it definitely represented the majority of the mining companies, the gold mining companies. I know they were collectively sort of referred to as the Gold Working Group. So it really, it provides meaningful compensation to all eligible workers suffering from silicosis as well as TB. And then it looks at the dates from the 12th of March, 1965 to date. So it's very much the first class action settlement of its kind. So interestingly enough, there was asbestos relief provided in the early 2000s, which also a trust was set up then to provide compensation. But that did not arise, I think, through a class action settlement. So there's now an estimated 40,000 potential claimants with 5 billion cost, with a potentially 5 billion cost. There's no limit on that cost, though. So if they do find more potential claimants than they've estimated, the burden will then fall on the Gold Working Group to make good that shortfall. There are 10 classes of claimants, so I'm not going to go through all of them, but just to note, it's interesting with silicosis class 1. It's the early stages of silicosis. So this looks at lung function impairment of up to 10%, which is actually not compensable in terms of edema. Silicosis 2 and 3 then relate to your first and second degree benefits under edema. So there's a special compensation class, etc. They also allow then for deceased claimants who were diagnosed with silicosis and it's been identified as the primary cause of death, etc. And there are various claimant classes for if you also contracted TB. Interestingly enough, there is an option to defer compensation to allow for the radiological progression of the disease to benefit from a higher payment. So that is quite interesting. So if you come in and you originally been diagnosed and you're putting in silicosis class 2, you have the option to defer in order for your disease to progress to silicosis class 3 in order to benefit from higher compensation. Whether individuals will take up this option is up for debate. I do think if you look at our ex-miners, etc., and their socioeconomic conditions, etc., I think many of them will take the upfront payment rather than defer. I do think, also the economic downturn, or I think we can call it crisis, which was obviously building up for a number of years, and then COVID-19 hit. It's obviously, I think, thrown a lot of your lower income groups into dire straits. So I don't necessarily think that option will be taken up widely. So it's also interesting that benefits are paid on the basis of the work, their service at the working group's mine. So if you have half your service at a non-working group mine from that period in 1965 to present, your benefit will be prorated, etc., to reflect the reduced service. They say there's no limit to the number of potential claimants, etc. So as I touched on, if they find more potential claimants than that 45,000 estimated, then the gold working group my companies will have to cough up the additional compensation. So just one point about that 40,000, it allows for a probability of those individuals actually to be found and paid. So it doesn't reflect the full estimated number of historic, of ex-miners, dead or alive, who contracted silicosis. We'll touch on that now when we look at problems with finding compensation, but it's very much linked, obviously, to issues like our unclaimed benefit burden in this country. That even if you find ex-mine workers, etc., they don't necessarily then get paid out either, due to various issues along the way. If you look at a progress report, so this I pulled yesterday. If you go to their website, it does, I think, provide daily reports, but only 363 payments as of yesterday, so a very slow start, which is quite surprising, given there was talk of then using the compensation fund database to quickly identify first and second degree claimants with silicosis and TB on that database, pushing them through the trust to make payments. So, the sad thing is time is not on the side of claimants. And I think COVID-19 has definitely exacerbated the need for urgency. It is quite an interactive website, so they do give daily updates. So this was as of 6th of October, maybe been yesterday or the day before, effective date, but 363 payments made. And the trust has been going for just over a year. So very slow start. Obviously, time is not on the side of claimants, given, the higher mortality, etc., associated with silicosis and TB. And then obviously COVID-19 has exacerbated the need for urgency, because no doubt COVID-19 will sort of push mortality for silicotics, etc., to higher levels. So despite the quick wins of what they could do is, and what I think they've been meaning to do is to, identify quickly the first and second degree claimants on the compensation fund for silicosis and TB and pushing them through the trust, which would amount to a fair amount of claimants. That would be a quick win for them. But after that, they will have to try and go out and find these ex-mine workers with silicosis throughout Southern Africa, in order for them to reach their targets in terms of number of claimants and making sure that redress is provided appropriately. So when I was sitting at the media session when they announced the settlement, so we're listening to Richard Spoor, he actually, he said they would be going through sort of rural village to rural village throughout Southern Africa in order to try and find these ex-miners with silicosis. So yeah, it is going to be a daunting task, but if they really want to provide, redress to all those affected who are still, alive, and possibly, those who died, and there's enough evidence that silicosis was the main reason for death, that is what they're going to have to do after doing the quick win of paying, moving compensation payments through the trust. All right, so, just to wrap up problems with providing compensation, obviously there's underreporting and below 100% payment rates. It does lead to suboptimal coverage in relation to compensation for silicosis and other occupational lung diseases in the mining industry. And just to note, then medical assistance is not part of compensation at this point. So there are some ministerial committees that are looking at this issue, as well as the broader issue of unclaimed benefits in South Africa, given I think if you look there below at the slide, you've got probably a 45 billion unclaimed for 4.2 million workers overall. So of that, there's 4 billion unclaimed for miners. Pension and provident funds, you've got 1.2 billion unclaimed for compensation funds. So that would be COID as well as CCOD, because COID will still cover your injuries, etc., under compensation funds. If you add all those figures up together and you look at the 5 billion tag on this, the trust
arising from the class action settlement. You know, you're looking at about 10 billion due to ex-mine workers. That really urgently needs to be paid out as soon as possible. So that, you know, some of the initiatives they have sort of been working on, and this is listed in the CCOD annual performance reports, is obviously linking the databases to banks and to other social protection funds, to SASSA, etc., to help actually with the tracking and tracing of claimants. But also just to note, you know, we've got an estimated 1/3 of ex-workers, mine workers, come from neighbouring companies, and there are lack of registration systems there, etc., which make obviously then finding claimants, potential claimants in those countries, quite a challenge. I know there has been help from TEBA, which maybe you'll remember, you know, the Temporary Employment Bureau Association or something like that, who used to manage sort of the labor from, you know, from rural areas, not in South Africa, but also from all our neighboring countries. They've also looked at implemented these one-stop centers that provide health services and other services to mining communities. And these, you know, ensure that retirement benefits, etc., were accessible to ex-mine workers. They've now been extended to help with the social security funds, so UIF, the compensation funds, etc. And from what I understand, they'll be using these centres as well for the trust. You know, what's important to note about sort of, I think, some of these ex-claimants, that, you know, some basic sort of things like having a bank account, many of them probably don't have. So, you know, there's an arduous task once you actually track down these claimants and you want to pay compensation for them, is getting all the necessary documentation, etc., as well as, you know, you've got to assist in setting up bank accounts, etc., so they can actually receive compensation. Besides this then, and it very much goes back to Richard Spoor's comment, is tracking and tracing is probably the only viable options to actually track down ex-mine workers through Southern Africa. And if that means, I think, moving from village to village throughout Southern Africa, I think, that will, that needs to be done in order to track down all these ex-mine workers who due compensation. And then just some points on eliminating silicosis. So there have been some activities to achieve this elimination. I know there's a national program for the elimination of silicosis, which is under the Department of Labour. You have some of it under the Mine Health and Safety Council, which obviously sits under the DMRE, etc. But I think one of the problems with eliminating silicosis is, having all these responsibilities spread under a number of departments is probably not the way to go, given our history, a government sort of track record. So some points that were raised by the Compensation Commissioner to Parliament is, I think the main issue does sit between two departments. So it's obviously the Department of Health, under which the Compensation Fund sits, and then the DMRE, which I think, which exacerbates them trying to put corrective action into place, because while the Compensation Commissioner can identify problems, etc., the enforcement part sits under the Department of Minerals and Energy. So there is a disconnect there. So interestingly, the occupational exposure limit is 0.1 milligram per cubic millimeters. But as we've touched on earlier, that's not necessarily a safe limit. There's increasing evidence that this limit is not protective against silicosis, and it very much goes back to that research I touched on earlier on, that, I think you still got a probability of 20% of contracting silicosis at that limit. So, I think, as he pointed out, it's a higher exposure than out of British Columbia, which sits at 0.025 milligrams per cubic millimeters. So he said, he doesn't have enforcement powers, as he pointed out. So this law is enforced under the Department of Minerals and Energy. So, I think there's really this disconnect. So, I think we've all probably also got a bit of fatigue with, we see all these programs across government to do certain things, and they don't come to fruition. etc. So that is, yeah, just on, you know, eliminating silicosis and where we are at now. Okay, so that's the end of the discussion. I'll take some questions now.
Great, thanks. Okay, who wants to kick off?
Claire, do you
Yes.
know whether the hospitals are forced by law or the health department to actually record and report cases of silicosis when they encounter them, or have they gone through the records of these hospitals picking up people?
That was actually something a question I asked. So I don't think it is. And it's quite interesting because obviously having a sister who's a doctor and speaking to her and her friends, particularly she did her internship in the Eastern Cape, East London or Buffalo City. So, you know, given that was a large labor sending area for a long time, she said they definitely encountered cases in hospitals, but no one knew there was sort of this compensation fund, and B, that, you know, then there's no reporting required either, which is quite sad because I thought that would be a quick win. They know, for example, RAF employed, so they know what to do then, but they don't know anything about, you know, the Mine and Works Compensation Fund, and you know what should be done if you actually have someone who comes in who could possibly be a claimant under that fund.
Well, I mean, you guys can now go to government and say, look, make available to us the hospital records. And then you can go through that, sift through that, and find all the cases that are reported as silicosis.
Yeah, so we have had some discussions there. We've also had some discussions about helping combine database and running advanced analytics to try and track down unclaimed, claimants, etc. They've been lost in this in the system. So, you know, looking at things like IEC election, the roll, your SASA database, your Home Affairs database, or your sort of databases from pension and provident funds like your Mine Workers Provident Fund, etc. So we have had discussions, but unfortunately, when you get to government, there's my experience, because I've done a lot of public sector work, I think there's some great individuals, but the system is just too big and too burdensome and too slow.
So you're being very tactful there, but I mean, you raise a critical point. I mean, you know, and I know, and I would say I have medical friends, you know, our regional and country and even, you know, big center medical systems and hospitals are just so incapacitated or broken. You know, those records just simply don't exist. I mean, it should be a no-brainer that when someone's to a hospital and has got a chest complaint, you know, you automatically look for silicosis and then, you know, pass that on to this trust, for example.
Yes, I do agree. And it, you know, it's quite a sensible, logical step to take, but yeah, sure.
No, you guys could lobby now that the government should impose that as a legal requirement for medical staff, that if such a case occurs, they're obliged to report it.
Yeah, well, I mean, again, being the cynic, you know, who do you lobby? I mean, look what happened to our sort of Minister of Health, you know, in the COVID crisis. You know, he ended up having his fingers in the cookie jar. So where do you actually start?
Yes, I mean, and, you know, we had Anban Pillay at an NHR workshop, you know, a month ago, 2 months ago now. He's been suspended. I think even the CFO, Ian van der Merwe, I knew him through the CCOD. He's now moved to Government Printing Works, but even there they say, you know, action's got to be taken against him. So you just, you know, some of the good relationships you think you forged. Sort of.
Tell me, do you know if people, if for instance, claimed at first stage, got paid, and then if they now later died at the final stage, if they could prove that, would they then get the difference in compensation, or is it a once pay?
I think they can. So that's under the compensation fund and the trust. I think the prime thing is it's either got to be identified as cause of death, or you've got to have a post-mortem carried out on the body.
And Claire, for interest, I mean, what happens, technically, so all these abandoned mines, and now there's armors. I mean, surely those guys must be usually exposed. I mean, that just continues to exacerbate the system.
Yes.
How do you ever deal with that?
Sure. Yeah, it's going to be interesting because if they have some sort of mining history, they've obviously had exposure already, so they could then still qualify under the compensation fund if they can track them down to a controlled mine, even if they but I mean that also holds a whole big can of worms. It's like our it's like our sort of the rapid increase in delivery, food delivery, convenience delivery, etc. And though you're sitting with a whole sort of sector of your labor force then who's apparently also unprotected, doesn't have coverage under COID, etc. So we often play catch up, I think, in terms of these developments, rather than sort of proactively implementing what needs to be implemented as the development occurs.
No, I mean, it's quite remarkable. I mean, we have this first world modern banking system. If you look at something like Capitec and how many people that actually reaches and how well that system works, but you can't run the SASA system. So you would have thought that this government would have woken up to using the private sector a great deal more for these sort of things.
Yeah, it's interesting that you think they would. So I think the initiatives would be great if they're private. I mean, we've had some great ideas. We've tried to push them, but I do sometimes think we actually then maybe to get top leadership from Deloitte to pull strings there, rather than us trying to deal with government itself. So we've often said, if you can get this to Ramaphosa's attention, then maybe something will, within his ministry and the presidency, something will happen. But I definitely couldn't do that at my level, but perhaps sort of our CEO, etc., could do, or through NEDLAC, possibly, because, time's been wasted, etc. So, I think so much could be done, especially unclaimed benefits, not just the mining industry, but, the problem of unclaimed benefits. We even had ideas that we could, we actually had sort of already one of the cell phone companies on board said they would be happy for us to use their database, etc. So if you can combine all these different sources of information, I think you could make a huge dent in the problem. Yeah.
Yeah. I mean, the brutal sadness for me is if you take both Cyril and Gavine and Tash, I mean, they were shop stewards. I mean, they were there at the front, front and center. They almost appeared to be disinterested in the industry that set or got them to where they are.
Yes, I do agree there. I think also the less said about Gavine, the more, the better. I don't think he's I do, when I look at sort of put together some of the statistics and having obviously worked with the fund, it's so sad to see that mining has really lost its importance. And a lot of that, particularly over the last 20 years, has been government's fault, no one else's fault.
Thank you very much, Claire. But, what do you see the way forward for us here?
I think we're probably going to plod along. I can't see. I mean, my hat's off to the commissioner. I think he's very visionary, etc. I think he knows what needs to be done, but he doesn't have the enforcement powers. And as I said before, I've dealt with some great people in government. I really have, public sector, but they're part of this machinery that they can't influence, etc. Yeah, I think we'll plod along.
Finish. I mean, you're bound to get some more questions. I've certainly got a bunch, but I'll come back to you on an email.
No, that's fine.
Yeah, and thanks.
No, you're welcome to. Send questions, etc. I'm happy to answer them or direct you to sort of the research that we've looked at, as well as where you can find a lot of these documents. On the net. Yes.
Thanks so much for all the effort you put into it and being so detailed, Claire. I mean, obviously, you have a master to work for as well, so you have to be a little tactful, but great for sharing
Yes.
and giving us, your frank opinions on certain points very tactfully.
Yeah. Okay. No, I enjoyed that.
No, thanks so much.